Hello, I'm Stephen Creasy. As EMTs, we need to be efficient in our field of study. Patients who have a trauma injury is somewhat different than a patient who has a medical injury. But there are a few things that you do the same when you treat them. One thing, you need to make sure that you have your universal precautions, your gloves, mask, goggles, anything like that that can help you keep from getting any kind of diseases or any kind of infection that's out there. Another thing is identify and treat life-threatening injuries. You do that from trauma to medical. That's what you're there for. I'm happy to speak with you today. The main topic for today is going to be trauma assessment and management. A little bit of my experiences. I've been with the Fire and Rescue Department for a little over 20 years. Also dealing with criminal justice. I've responded on several, if not thousands, of traumatic injury calls. I've also taught for several years about trauma assessment. First thing for the trauma patient care is you need to minimize your time on scene. If you're going down and you find something wrong, you just need to get out there. You want the less time on scene so they can get to the hospital. All right, first thing we're going to do is concentrate on the primary survey and vital signs. In the primary survey, you have your A, B, C, D, and E, which is right here to my right. Airway, what you'll do, and this is my little mannequin who's going to be helping me out. I'm going to name him Alex. For the airway, I'm just going to say, go up to him, Alex, are you okay? He's not responding to me. And I'm going to open his airway. When opening his airway, I'm already assuming that this is a traumatic injury. In doing so, I'm going to do what is called a modified jaw thrust, which y'all are aware of, to open his airway. Once I have his airway open, with the modified jaw thrust, if I do have someone available, I'm going to have them, my other partner, put on a cervical collar. After that is on, I've got to actually go into breathing. When I get down, look, listen, and feeling. I'm listening for and feeling for his breath coming out of his mouth and nose on the side of my cheek. I'm also looking for his chest rising and falling to make sure that they're equal and he is breathing. If he's not breathing, I would start rescue breathing. Check his pulse. If he has a pulse and still not breathing, I'll just continue to rescue breathing. One thing for not having breathing, according to Wells, you need to open and maintain the airway and give high flow oxygen. Back on circulation, you're going to check the carotid pulse right here at his neck, just on the side of his Adam's apple. He does have a pulse. Then I'm going to go into a quick body scan, just looking for any kind of bleeding, hemorrhaging, spurting of blood, which you need to take care of right then, any kind of heavy bleeding. Also, you can check skin temperature and moisture. You can do it with the back of your hand, with that. Then I'm going to go into the AVPU, which is right here to my right, which is basically the D in it for disability. You're checking for alert. Obviously, Alex here is not alert. You're going by verbal stimuli is, Alex, are you okay? Doesn't respond, so then I'm going to go into painful stimuli, which could be a sternum rub, pinching of the fingers, pinching of the foot, pinching of the shoulder, something like that. And keep in mind, according to STAR, the stronger the stimulus can recruit more sensory receptors than a weaker one. Right? If there's no response, then it is unresponsive. And then you're going to have to expose. Once you expose, you only expose what is necessary. All right, then moving into vitals, what you'll do is end up checking his pulse. This is radial pulse right here. Also, while you're checking the pulse, you can check for breathings, respirations. You're going to check it for 30 seconds each. Okay, but you can do this at the same time. And watching his chest rise and fall and checking for pulse. Then you're going to go into his blood pressure, which you check his arm before you provide his blood pressure cuff and stethoscope to his arm. Once you get that, you can check his blood pressure. Also, keeping in mind your vital signs and the parameters of that. Then after that, then thirdly, what we're going to talk about is conducting a rapid trauma assessment, which is basically head-to-toe exam, which is end up being a load and go. You find some kind of life-threatening situation, you need to pick them up, you need to get to the hospital, and you do the exam and route. Then finally, we're going to talk about just the ongoing assessment, which is once you package patient, put them in the ambulance, You check in his vitals, ABCs throughout transport. And also your packaging any kind of other wounds or fixing any kind of fractures. And just in conclusion real quick, we've received as EMTs today just information on trauma assessment and management, specifically on primary survey and vital signs. Don't forget your scene safety, your gloves, anything that puts you at danger while you're treating the patient. You're number one in this. Also, I just want to thank you for being here today and letting me teach y'all and give you a little bit of review on trauma assessment and management. And I'd like to leave here with what scripture for y'all, which is Matthew 14:14. Jesus went forth and saw a great multitude and was moved with compassion toward them, and he healed them. Thank you.